BPC-157, is it a healing miracle or a risky gray area market gamble? Picture this, you've had shoulder pain for 8 months. You've done physical therapy, tried anti-inflammatories, maybe even gotten a steroid shot. You research BPC-157 online and suddenly you're in a world of before and after stories, peptide clinics, Reddit threads, and websites promising faster healing and gut repair. But here's a problem. BPC-157 is not FDA approved for any condition and no benefit has been proven in humans through rigorous clinical trials. Is it a breakthrough, a risky trend, or something in between? I'm Dr. Zaid Fadul, board certified family physician, Air Force flight surgeon, and founder of Bespoke Concierge MD. In the next 10 minutes, I'll walk you through what BPC-157 is, its proven benefits, the biggest safety concerns, and how to think about it as a patient trying to make a smart decision. By the end, you'll know whether BPC-157 is worth trying and the 3 questions to ask before you ever touch it. Okay, let's dive in. BPC-157 stands for Body Protective Compound 157. It's a synthetic compound, a short chain of amino acids that was found in human gastric juice. That stomach connection matters. Most peptides get destroyed when you swallow them, but BPC-157 appears to stay stable in gastric juice for over 24 hours, which is why people talk about oral BPC-157. If you're totally new to peptides, check out my video linked above. It's the best place to start. So if this compound comes from the gut and survives stomach acid, why are people injecting it for tendon injuries, joint pain, and muscle recovery? To answer that, we have to look at how it may work. After an injury, your body needs blood flow, controlled inflammation, collagen, and new tissue. If one part breaks down, healing slows. BPC-157 appears to affect several of those repair systems at once. First, it interacts with the nitric oxide system, helping blood vessels relax and open to deliver oxygen where it's needed. Second, it appears to activate VEGF-R2 related pathways, which are involved in the formation of new blood vessels. That matters because tendons and ligaments don't have great blood supply, which is one reason they take so long to heal. Third, it may support tendon cell migration and survival. That doesn't mean it magically regrows tissue in humans, but it helps explain why animal tendon studies look promising. The biology is genuinely interesting, but interesting biology isn't the same as proven treatment, which brings us to the question everyone wants answered. Here we separate 2 worlds, animal research and human proof. In animals, BPC-157 has been studied for tendon, gut, muscle, bone, wound, and nerve healing. For tendons and ligaments, studies show improved healing strength, better collagen organization, and improved function. If joint and tendon recovery is your main reason for being here, I go deeper in an overview video of the peptides that help, linked above. Now, let's talk gut, where the story actually begins and the animal data is most compelling. Since this compound was isolated from a protective peptide in gastric juice, the gut is its home turf. It appears to protect against and heal stomach and intestinal damage from NSAIDs like ibuprofen and naproxen. It reduced inflammation and improved intestinal healing in rodent colitis models. It seems to support the gut barrier itself, the single cell lining people loosely call leaky gut. But here's a caveat. All of that gut evidence is preclinical. The only human data is an early phase ulcerative colitis program and a tiny bladder condition pilot. So the accurate version of BPC-157 heals your gut is, it heals guts in rats. And it's plausible but unproven in people. That pattern holds everywhere. Tendons, gut, nerves, faster healing in rats. Human proof is a very different story. Fewer than 30 total subjects across 3 uncontrolled pilot studies. I'll be honest about my own experience. My wife tried BPC-157 for a nagging shoulder injury, and within days, most of the pain resolved. I was genuinely amazed. But as a physician, I have to call that what it is, an anecdote. One person, no control, no way to rule out natural healing or placebo. It did not make it proven. It did give me less headaches from her complaining about it though. And her few days result is the exception, not the rule. In studies, effects showed up over 4 to 6 weeks. If someone promises a 3-day miracle, be skeptical. A result that fast is just as likely to be natural recovery or placebo as the peptide itself. So which camp are you in? Hopeful or skeptical? Let me know in the comments. BPC-157 may be promising for tissue repair, injury recovery, and gut injury, but with only 30 human subjects, it isn't proven medicine yet. And if something isn't proven, the next question matters even more. This is where a lot of online videos get sloppy. They say no side effects have been reported, but that's not the same as proving safety. Animal toxicology is somewhat reassuring, with no serious issues so far, but human safety data is thin. Here's what I'd want my patients to understand. It's pro-angiogenic. It promotes blood vessel growth. Tumors depend on building their own blood supply. So in someone with active cancer or a cancer history, there's a chance it could help that cancer grow faster. There's no direct evidence it causes cancer, but that uncertainty is exactly why I confirm cancer screening is current first. It may affect blood clotting. If you take aspirin, Plavix, warfarin, Eliquis, or Xarelto, watch for bruising, nosebleeds, or blood in the stool or urine. It may lower blood pressure through nitric oxide-mediated vasodilation. Stacked on blood pressure medication, you can drop too low, leading to lightheadedness, dizziness on standing, and fatigue. Monitor closely and keep your doctor in the loop. Interacts with dopamine, serotonin, and GABA systems. If you're on antidepressants, antipsychotics, or stimulants, watch for unexpected changes in mood, sedation, or other side effects. So let me be blunt about who should not experiment with this alone. Someone with a cancer history, people on blood thinners like warfarin, women who are pregnant or trying to conceive, or anyone with serious heart or blood pressure disease. That's a hard no until you've talked to a physician who knows your history. The theme across all four is the same. BPC-157 doesn't act in isolation. It quietly interacts with the medications and conditions you already have, which is exactly why self-directed use is where people get into trouble. So if someone chooses to use BPC-157, what should responsible monitoring look like? There's no official guideline because the human data isn't there. This is expert opinion guidance based on how the compound behaves. If you take one screenshot from this video, make it this list. Start with a baseline, then recheck periodically. First, liver function, the primary site where this peptide is cleared. Next, kidney function, including creatinine and eGFR. Next, complete blood count and platelets, given the clotting effects. Coagulation markers like PTINR, especially on a blood thinner. Blood pressure, ideally tracked at home. A current medication review to catch interactions early. Confirmation that cancer screening is up to date. And one people always forget, the product itself. Ask for a certificate of analysis and third-party testing. The takeaway, this is not a buy it, inject it, hope for the best compound. This is exactly what my team and I do at Bespoke Concierge MD, tracking the markers that matter and adjusting based on your real data instead of guesswork. Even if BPC-157 turns out safer than expected, the product you buy online may not be what the label says, and no validated pharmaceutical-grade formulation exists for routine clinical use. A systematic analysis of falsified peptide drugs found purity ranging from just 5% to 75%, with major dose variation and toxic impurities including arsenic and lead. So you might think you're injecting BPC-157, but actually get the wrong dose, a degraded peptide, bacterial contamination, or heavy metals. And a single gray market vial runs anywhere from $50 to several $100. Real money for zero quality guarantee. This is why the real question isn't, does BPC-157 work? It's, do you know exactly what you're putting into your body, and is anyone monitoring you? Most anecdotal protocols use a daily microgram range dose once or twice a day, run in cycles, often 4 to 8 weeks on, then a similar break off. None of that comes from human safety data, it's convention and forums. A popular protocol is not a safe protocol, and any dosing should be individualized and paired with monitoring. You probably also heard BPC-157 paired with TB500 in the Wolverine stack, the idea being that two different peptides hit repair pathways and heal you faster. It's a catchy theory, but there's no human trial testing that combination. You'd be stacking one unproven compound on another and hoping they add up. I break down TB500 in a separate video linked above, so you can judge for yourself. Now, the most common practical question within dosing is how to take it at all. People constantly ask whether BPC-157 should be oral or injectable. Oral makes biological sense for gut issues because it's unusually stable in gastric juice, aligned with where it was discovered. Injectable is usually better for musculoskeletal injuries because it may create more systemic exposure. For my patients, I generally suggest oral for GI issues like inflammatory bowel disease and injectable for systemic issues like muscle aches or tissue repair. But the route should ultimately depend on your medical history, medications, risks, goals, and whether the product is even legitimate. If you're considering BPC-157, don't start with the peptide. Start with the diagnosis. If your knee hurts, is it tendinopathy, arthritis, meniscus damage, inflammatory disease, or referred pain from your hip or back? If your gut is inflamed, is it IBS, IBD, celiac disease, medication injury, or infection? Using BPC-157 without a diagnosis is like putting premium fuel in a car without checking if the engine is broken. So remember those 3 questions I promised at the start? The ones to ask before you ever touch this? Here they are. Question 1, what am I actually treating? Not what do I want to fix, what's the actual diagnosis? Because a peptide is not a diagnosis. Question 2, is this exact product third-party tested with a certificate of analysis I can actually see? If the answer is no, you don't know what's in the vial. Question 3, who is monitoring me? Who's checking my labs, my blood pressure, my medications, and catching a problem before it becomes an emergency? If you can't answer all 3 with confidence, you're not ready to use BPC-157. You're just hoping, and hope is not a medical plan. Let me answer the questions I get asked most fast. Is BPC-157 legal? It's not FDA approved and its status keeps shifting, so verify the current rules. Is it safe? We don't truly know. The human data is thin and the biggest practical danger is contamination from unregulated products. Oral or injectable? Oral leans gut, injectable leans musculoskeletal, but neither has a validated human dose. Does it actually work? In animals, consistently. In humans, promising but unproven. So BPC-157 is not a miracle peptide, it's a promising but still investigational compound that deserves careful medical thinking. If you want a physician who will have a real conversation about emerging therapies without rushing you, dismissing you, or pushing cookie-cutter medicine, that's exactly what Bespoke Concierge MD is built for. Membership spots are limited because we work personally with every patient. If this helped you understand BPC-157 more clearly, hit like, subscribe, and leave your questions below. And remember, the goal isn't to chase every new therapy, it's to make better decisions with better information. Now, if you want to understand the Wolverine stack better, the video on the right covers TB500 and its benefits. The playlist on the left covers peptides and related health issues in detail. And hit subscribe. I publish evidence-based medical content every week that could change your life. See you in the next video.